Amin. I hope I'm pronouncing the name correctly. Hello, Dr. Morse. I'm Amin from Armenia, and I'm glad I found you, but I think a little late. What are we talking about here? My mother diagnosed with stage 4, her 2+ breast cancer, which metastasized to the bone, skull, ribs, pelvis, spine. 3 years ago. Had 6 sessions of chemo and 20 sessions of radiation. Also 18 injected Herceptin and 24 injections of Zometa, whatever that is. Some type of, it's a zolidoramic, something like that, acid. You know, if you look at Tobro, here it's in your face, when he cuts out these ingrown toenails, what does he put in those places that he cut out the ingrown toenails? Acids. He says, I got to put acids in here to stop it from growing again. I'm just saying. It's all over when you look at it. When you look at truth, it's all over the place. She back to normal life with small amount of pain until 4 months ago her markers began to rise. That's what I call, my dear one, the chemo radiation blowback. And it can be a nightmare from hell because all they did was suppress the stats. You can burn someone up pretty good. That's just what they do to her, is burn her up inside. And then, everything looks good. Yeah, the blowback's coming. That's the problem. And then they blame your cancer, which is a disease coming from Hellville that no one knows anything about, is spreading. It's coming to get you, and it's going to take your life. These guys exacerbated the problem 1,000,000 times fold. They're part of the problem, not part of man's solution. If you can survive these things, you always see the brain cancer free once in a while on this sort of thing. Really, if you read the undertone, it's in remission. Once in a while, you'll get a tumor free or something like that, but it's rare. And then, of course, you're just up to have it again, have it all over you because you don't understand the system involved and all of this. So it doesn't matter the stage. Stage 4, yeah, chronic area, no problem. But it doesn't mean death. It means you really get your butt in gear and get on a great diet. If it's me and I'm stage 4 anything, I'm going immediately on a grape diet. Dark, as organic as I can find. I'm going to be on a grape diet. Now I'm going to investigate the herbs to go after my lymphatic system. I'm going to go after kidneys aggressively, 2 or 3 formulas. I'm going to go after my adrenal glands. I'm going to go after my lymphatic system. I'm going to clean up my GI tract because remember, that's the trunk of a tree that goes everywhere. So I'm going to do some of these things to go after myself aggressively. Absolutely. Because the treatment is what's getting you. You can sit there and allow the lymphatic system to back up, and it's going to burn places, and and you're going to break down cells, da-da-da-da. So just get on, unless you're burning your whole body up. What really accelerates death is the chemo and all that by 1,000 times. What was it? We've got study after study, and a couple of them are from very reputable universities, showing that if you don't do chemo, you'll live 12 times longer. And some people will live the rest of their life without it. Because you're diagnosed with 1 or 2 cells that are damaged, and maybe a little tumor here or there, you're going to pull the scare fear and kill yourself? Yeah. And they wonder, well, we tried all these injections, we tried radiation, we tried chemo, none of these are effective because your monster cancer that they don't know anything about is now getting you. You've got to get out of that level of thinking because that is like the lowest level of thinking there is. That level of thinking is amazing, and yet these people are allowed. They have license to kill people, license to give people Drano, and all these things. And we've set these jokers up. And it's time people wake up. The medical profession is not where you want to go when you're in trouble with your health, unless you need surgery or an emergency room. And that's what that should be for. Emergency room should dictate whether you need surgery, and if not, you need to be sent to a naturopathist. You can't even go to a naturopath anymore because they've been taught medical. To me, most naturopathic physicians are medical doctor wannabes. Because if you're a true naturopath, you don't want to do anything medical. Naturopathy has nothing to do with medicines, the treatment of diseases. Matter of fact, we teach against that type of thing, but there's not a lot of us out there. Matter of fact, very, very, very few. But that's why we're trying to make a difference. I'll put any of you guys that have been watching our YouTubes and have been healing others up against any naturopath in this world. And they've been to school trying to learn a little bit about natural healing, but then get away from high protein diets. You know, in the natural health field, I've been in this almost 50 years. I can tell you, getting into it years ago, the first thing you eliminate is meat. Dead animal tissue. That's the first and foremost thing you eliminate. Now you want to get organic meat and you want to have high protein. Dude, really? That's not natural health. Not at all. That's medical thinking. You might have a natural health practitioner telling you that. It shows there, woohoo, cuckoo. Stupid. And this has been, you know, I've helped to bring this natural health field up into a level that you guys are seeing, and it is not moving well following me. You guys are. But we have to bring the natural health people in line with this. Even supplement makers are still involved in treatment-based thinking. So we've got a lot to do in terms of raising the consciousness or the awareness of even the natural health field. Who cares what happens to the medical field? People are going to run from them one of these days, and a lot of them are going to go to jail. When it's found out truly about chemistry and what chemo is really doing to people, it's going to be a crime to administer it. It's Drano. Who in their right mind, you go in front of a judge or something and say, well, you know, this doctor recommended me take Drano. Or how about Connecticut, whose Supreme Court said, yeah, take that 17-year-old and give her Drano. Yeah. Those guys should have been marched right down to the local jail. Stupid. Crazy. So let me see. I convince you to go for a raw vegan diet, especially juice fasting, carrot and apple and vegetable juice. You know, those are the old days, guys. Those are the old days. I've been on so many carrot juice fasts I can't even name them. Right. I say, so do this for me. Even who is this that wrote here? Oh, Amin. Put yourself on a week of carrot juice, and then put yourself on a week of dark grape juice, Concord grape juice, and then put yourself on a week of lemon juice, and you tell me the difference. Huge. And 2 coffee enemas per day. You know, again, you're giving her an acid enema, and you're overstimulating tissue. What are you going to accomplish with that? So when you have stimulation, you have innervation. You know, you don't want to play the teeter-totter game. The teeter-totter is creation. And that's what I'm talking about, thoughts and things like this. It's teeter-totter. You know, what you stimulate, you end up innervating. It's like this. You know, going back to Gerson again. You know, that's old school thinking, but they never grew up. It's like the Hippocrates. They never grew up. They're stuck in these mindsets, and they never grew up. So whatever you stimulate one day, you innervate the next. It's like laxatives, stimulants. You take stimulants, and then your bowels don't want to work at all after a while. Coffee enemas. I had a dentist that come in here, had been on coffee enemas for years, and I said, I know why you're in to see me then. He said, why? And I said, you can't poop at all now, can you? And he said, no. You innervated yourself right on down. You know, you can't do that. That's not going to make the lymph system work any better. There is a simple chemistry pathway here, and it is the alkaline pathway. You can't try to ram a bull up someone's butt when you pull the panic button. When you realize truth, you can't ram a bull up. You have to allow for proper ionization to go on here, and that is hydration. And that takes place on these high, powerful juice or high fruit programs. At the same time, we can bring our brother and sister in of the Botanical kingdom and help to enhance the function of the cells and the tissues we need to, and help to pull on the lymphatic system, clean the blood. So botanicals are incredible. That's why I don't get into supplements, isolates. Well, that's treatment. And what are you trying to treat? You know, your body's reacting to chemistry. When you see tumors, it's a reaction to your chemistry, your lifestyle, added on top of what your mother gave you lymphatically. So you're trying to treat your lifestyle with the same type of chemistry and playing those games that got you here. You got to radically understand that foods fall into two categories just like chemistry. You have acid ash foods and you have alkaline ash foods. There's only one answer when you're acidic. Only one. And it's easy. Now, understanding the lymphatic system a little more, and the kidney connection, the skin connection, the adrenal to kidneys and the thyroid to skin, that is very helpful in enhancing the function of these tissues to help you get, as you're hydrating through your diets, to help this pathway to open up better. That's all it is. Because with anything else, you're trying to treat a condition you don't understand. Coffee enemas and things like this. And I mean, it's a good jump from your mother from where she was. I'm not complaining or bitching, but let's take her up to the top of the mountain because she's in trouble. So you want to take her to the top of the mountain when you're in trouble. Also, she said, I don't want Zometa anymore, and we stopped taking Zometa. Last month, severe pain came in her back and pelvic area. Well, the chemo and radiation has probably broke down her bone cells. Throw the word metastasize out. Go let a medical doctor chew on that for a few years. The whole system's down, and they went in and they burned on top of the already 3 pH burn. They went right on top of that and burned her more aggressively. So they break down bone cells and all these other cells, and then you go, oh, these are cancer cells. Your cancer moved on you. That's their way of trying to protect themselves and what they're doing to you. No. Scans show bone mets growing fast to her skull and spine and pelvic bones. Well, everywhere there's interstitial spaces, she's in trouble. So where is that? Everywhere. Everywhere. The pain was so severe that no painkiller could reduce her pain. I feel sorry for her. I feel sorry for these people that are victims of the AMA, or medical thinkers. But remember, this is all karma, and we have to help others undo their karmatic bondage. And this poor thing needs some help. There was no choice but radiation. After 20 sessions of limited radiation. Oh, really? Yeah, we're going to limit the chemo we give you. We're going to limit the radiation we give you. Her pain is much better now. Oh no, wait till the blowback comes. Wait till the blowback. You know, they can destroy the nerve endings and stuff like that. Just wait till the blowback. I know radiation put more toxins in her body and it burned her. But we don't know what to do with her pain. You know what? I feel really sorry for this lady. But you're going to have to find, and even morphine sulfate, that's about as strong as you can get, except this new painkiller, and it's like 10 times stronger than fentanyl. Probably take her right out. The only way to start going after that pain is on the alkaline side of chemistry. Her doctor suggesting chemo, but we said no. He told us at least you should go to Herceptin and Zometa again, and the advancing of bone tumors is a result of abandoning. These guys are just saying king size, stupid. Your mom is in deep trouble, my friend. And until she gets onto these higher levels of understanding, she's going to continue to play this ping pong ball of the medical profession. I feel guilty about it, but I thought it's an acidic drug and it's a toxin to her body. Go back to the first word you used, acid. Doesn't matter whether it's a toxin, it's an acid. And all acids could be considered toxins. Now, dear Dr. Morse, please tell us what should we do? Right there. you jump her on a high fruit diet, grapes, not lemon juice, not orange juice, not anything that's acidic juice. Go to the grapes, dark organic grape juice. Have her live on it. At the same time, you want to use herbs to get in there and get those kidneys moving. Go down this pathway. Using these two drugs along with fruit diet. I mean, you could initially. You could. I mean, you could, and then titrate off of them as you will, I guess. I mean, you can do that. Or we should just go with fruit diet only. Well, you know, you have to make those decisions. I can't make those decisions for you. It's not my place to do that. Because you have to determine. I'm not in any chemo meds or anything like that because you're playing this tug of war with everything. You're sitting on a barbed wire fence trying to straddle that. So I always think, is there any hope? It's getting down there, you know, but I would go aggressively and see what you can do. If you can get her kidneys to filter sooner than later, you might have a good chance to pull her out of this. The more tissue is damaged, the more difficult it is the body to survive. The body cells are exclusively cells, and cells are structure function. Destroy the cells and you destroy structure function. The fluids are there just to help the cells clean and feed them. So if you destroy the cells of the human body, you're destroying the human body. And that's what radiation, chemo, that's what she's doing now. Her diet destroyed her body. And nobody is awake of that enough except those that listen to these YouTube places and start to learn about the raw living foods and the fact that man isn't designed to cook and process or put. No animal is. You can't feed your domesticated animals cooked to processed foods or they come down with the same problems you do. This is not realistic. And feeding herbivores grains is not realistic either. They'll get acidosis. What do you think Purina's pulling grains out of there? There's, like I said, if you want dog food, get rabbit doo-doo. Alkaline ash foods. Difficult. Is these, in these many years, look at all the years that this poor lady has suffered. In your experience, did you ever have a patient with bone mets or HER2 cancers that healed from this disease with fruit diet or painkillers, toxins too? I definitely have had cases that have pulled themselves out of these levels. But I don't use just a fruit diet. I use botanicals aggressively. I would never do just a fruit diet with this level of a problem. Not at all. It would take too long. I don't treat diseases. So no one survived diseases. They're unsurvivable, according to the AMA. But we don't look at it, we don't look at her trouble as a disease problem. Her problem came in with her diet and she created too much acidosis, breaking down kidneys, GI tract, whatever. Take a look at her genetics, see what's going on there. And this is a lymphatic stagnation. She is dying on her own sewage. She's dying on her own sewage, and the medical doctors are adding more acids to this acid sewage and at a hotter pH. And then wonder, well, we're doing everything we can do, to accelerate her death. You know, like I said, you can burn things and make everything look good for a short time, and then you have the blowback. Excuse me. The blowback is what your mom's experiencing, and it ain't good. High-level pain, all these things like this. They've got her up to these levels of, difficulty. They're taking her body into a corner that's hard to get out of, no question about it. But you got to try. It's your mom. You got to try, and whatever she's willing to do. If you have to use painkillers, my friend, you have to use painkillers. I would also use brain and nerve formulas to help enhance neurons since you're suppressing them. So it sounds like a little tug of war, but I would use painkillers but enhance the function of neurons and also enhance the adrenal glands. This is why we go into these tissues and enhance their function. We bring hydration, which is anti-pain. Pain is on the acid side of chemistry big time. And they're adding more acids into her body, which is accelerating the pain more. After chemo, her triglyceride level's gone high, you think? Why do you think her lipids are going to skyrocket with that after chemo? What side of chemistry is chemo on? It's not base, it's not alkaline. Nope. I mean, one day when they learn that, I might argue good alkaline chemo. Who knows? No. This is high acid chemo. So what system buffers acids in the body? There's only one. Only one. The lymphatic system. And what is its base? Lipids. Cholesterol specifically, but lipids. So yes, your triglycerides, your lipids are going to skyrocket. Your cholesterol can start plaquing all through you. Then start off shutting off circulation. I mean, they're killing her. And she's killed herself. So pull her back from all that if you want to save her. My opinion. And her LDL 212, but she was on strict low natural olive oil and no sugar and no dairies after her treatments in these 3 years. Okay, so oils. Why are you giving her oils? I mean, I'm not opposed to coconut oils and stuff like that. It might be something you might think about, is giving your mom some coconut water. Getting some things that are a little more oil-based, but you can't do too much of that, because then you start affecting the blood. Even though oils are more absorbed into the lymphatic system, but you have major stagnation in her lymph system. That's why I'm afraid to even do castor oil packs, because you have highly agglomerated areas adding more oils to this. Now, it can help the pain. You might give her some CBD oil, if that's even allowed where you are. Some high CBD oil, and see if that'll help with her pain. Or you could give her, I used to give MS and these sort of things, evening primrose oil or something like that. Maybe that'll help her pain. But you don't want to give her too many oils, because then you get ketosis and things like this. The no sugar, you have to have sugar. Let's define sugar. You have to have simple sugar, or your mom ain't going to make it, period. Fruit is simple sugar. Vegetables are simple sugar. Mandatory for human survival. We've talked about this quite a bit. Dairy products, no kidding. She should have stopped that a long time ago. Meats, any acid-ass foods. Are you kidding? Also, after a raw vegan diet, her alkaline phosphatase goes from 66 to 380. Well, that's probably bone. Could be liver. With chemo and all of that, alkaline phosphatase, guys, is either liver. It's a liver enzyme, but also going to be kidneys and bone. So looking at her with the bone issues, that's either bone. You could probably guess it's part of all three, because chemotherapy destroys all tissue, all tissues. So flip a coin, doesn't matter. All threes, but I'd be going after the liver anyway because of the chemo. I'd be having on liver herbs big time. The Barber's family, big time. Are you kidding? Direct bilirubin, very low. Well, her liver enzymes are 93. Well, that's not too bad. A little elevated. They should be, you want your liver enzymes, AST, ALT, you want them around 15 to 20 at best. So they're not sky high, so that alkaline phosphatase is. So I would probably be looking, a little liver, but I'd also be looking at bone as possibly a part of that. Creatinine 1.2. Now the creatinine's 1.2. That's her kidneys. So that's already breaking down on her. Despite what blood biochemists say, you don't want your creatinine to be over 0.6. And if you're 0.6, I'm still got a little eyebrow up. But 0.7, my eyebrows are going up on you. In a lot of labs in America, 1.2 is in normal range now. They've increased it from 0.9 to 1.2, 1.3. When you pass 1, you're in trouble. You're in trouble at 0.9. You're probably not filtering at 0.7, and you could not be filtering at even 0.5 yet. Just because the kidneys are not breaking down yet, still could be swollen with inflammation. Edema from acidosis within the kidney tissues. So you always want a creatinine low. The lower the better. 0.5, 0.4, yeah. But you also want the bun down there too. That's your urea nitrogens. You want your bun along with that to be down at 0.4. You want the lab to take it low. Good, thanks. So I don't see, these liver enzymes are not that high. We get them up there in the hundreds, guys. But your AST is getting up there. But the alkaline phosphatase, if it's pointing my finger at a little liver, but I'm looking more at bone, even with the kidney 1.5, your alkaline phosphatase wouldn't be that high. You might maybe at 3s, 4s, but your mom, the kidneys are the problem in the get-go, and this just shows you right here where the problem is. This number makes us nervous and don't know why everything is getting worse. You don't know? Come on, man. Her kidneys are down. She's going to go into kidney failure anyway with the chemo and everything else. And so that's what finally ends life there is kidney failure. Well, her creatine's going up. Your alkaline phosphatase. Why wouldn't you have these high numbers? What are you doing to fix these numbers? What have you done to help her body? A raw vegan diet? No, she needs a fruitarian diet. She needs to be on a raw grape diet. And then you want to add botanicals in there like crazy. What do you think God gave the herbs for? To sit there and whistle Dixie? They're there to use. That's why China and India are some of the premier users of botanicals. And for centuries, man has just turned his educated eye the other way, or the nose the other way. Oh, really? Well, let me tell you, our educated noses are going to be going right back to them and go begging God, thank you. Let's raise more of them. Let's grow more of them. Thank you, Dr. Morse, and God bless you for taking care of sad and helpless people like us. Well, you know what? I love you, man. But go after your mom. Go after your mom. I can't advise you to come off of medications, but if it was me, I'd be changing the way I think. I'd be looking at more of our videos and really getting yourself aligned with that level of thinking, if it's me. All right, I got time for one more. I cannot pronounce your name. Which treatment for prostate cancer stage 4? Well, let's just lump all these things together because they all are saying the same thing. First of all, let me make it perfectly clear that we do not treat cancer. It's not because I want to keep my butt out of trouble. It's because it's the wrong way to look at it. Cancer is a fabrication of the medical mind. If you have a damaged cell in the prostate, and I've seen them poke that prostate many times to find a damaged cell. So, when they do a biopsy, they're trying to find a cancer cell. And that supposedly gives them, I guess, jurisdiction to give you Drano, I guess. I don't know. You'd have to look at the laws and stuff. Stupid. Stupid, stupid, stupid. Assume that there are cells that have been damaged to the point of no return. Assume that. How does your body get rid of those cells? There's only one pathway, and it ain't the blood. There's only one pathway. It's in your A&P. But they seem to forget that coursework, I guess. That one pathway is where? Lymphatic, lymph tissue, interstitial fluids. Just call it lymph fluids because it's just what it is. And the lymph nodes is where what? The macrophages are, right? The problem is when you get stagnation, that's when you see cancers that are cells that are breaking down. You don't get cells that are breaking down when you don't have stagnation of lymph. That's just inflammatory problems. When you start to see it starting to back up. But the next stage from that is going to be the breaking down of tissue. And we talk about intracellular and extracellular. What goes on inside of a cell and what goes on outside of a cell. Whenever you retain acids, think of a baby's bottom when a diaper hasn't been changed for quite a while. The blowback is burning. Acids burn. They are corrosive to cells. You don't stick your finger in corrosive acids and be happy. You don't drink Drano. They give it to you through your aorta, but you don't drink it on purpose. If this chemo was renamed Drano, would you still take it? The pH is probably very similar. Would you take it? Hell no, you wouldn't take it, so we changed the name. Put it chemo. Maybe you should call it acido. You know, we have to teach each other chemistry a little bit, basic chemistry. And there's no one on this planet that can deny it, because they are factually the two pillars of chemistry. Who can deny that? You might get chemists to argue alkalosis, but they're going nowhere with that. You can demonstrate that metabolitic wastes are acids, not alkalis. You can demonstrate it just by bunking their theory by putting you on an alkaline diet, showing you how it gets rid of acidosis, it gets rid of man's symptoms and problems. Oh. Protein diets, we can demonstrate that all day long in their face. When you go on a high protein diet, your enzymes skyrocket, your cancer markers skyrocket. Oh, but no correlation to medical mind, stupid mind, to facts. Sorry, but you know what? Sometimes you have to get a little aggressive when people like this are allowed to do the things they do to humans. You have to stand up against this sort of abuse and atrocities. These are atrocities against humans because of ignorance. And we can't allow that to happen anymore. That's why all these questions, all these poor people are suffering. We've got stacks and stacks waiting for me to answer. I can't get to them. But what applies to one human applies to us all. We're all Homo sapiens. We're all from the same species. Now what color, race, creed, who cares? We're all Homo sapiens. Yes, we have genetic lineages, absolutely. And they're different than others and others. Yeah, I get that. But we're all cellular bodies with two fluids. End of story. Ones have some female parts, some have male parts. Duh. They're still cells with two fluids.